surgery وبالذات الكنال. وبالذات الانال كانال، وبدينا بالاناتومي congenital abnormalities and pilonidal sinus. Today I will start with surgery of hemorrhoid. This is important subject because it is very common. It means hemorrhoid or pile اللي هي طبعا البواسير. It means dilated veins in relation to the anus. It may be internal or external in relation to the anal orifice. Internal type covered by mucosa of anus, while external type covered with skin. إذن حتى نفرق بين الانترنال hemorrhoid والاكسترنال hemorrhoid. Internal covered with mucosa, while external covered with skin, by skin. If both type present, then internal external hemorrhoid will form. يعني internal external hemorrhoid. Location at 3, 7, 11 o'clock. الليثوتومي بوزيشن. يعني منه فحص المريض نخلي ليثوتومي بوزيشن. المكان اليوجوال site for hemorrhoid 3 o'clock, 7 o'clock and 11 o'clock. وعرفنا ليش؟ لأن السوبيريور hemorrhoidal artery give a right and left branches. A right branch divided to anterior and posterior branches. Hemorrhoid may appear secondary to hemorrhoid may be secondary to يعني causes of hemorrhoid. CA colon due to compression to the superior rectal vein. B during pregnancy. C during continuous straining as in benign prostatic hyperplasia and urethral stricture. D during chronic constipation. Then high إنه causes of secondary hemorrhoid. CA colon during pregnancy, during continuous straining, like in BPH and urethral stricture, and during chronic constipation. Regarding the pathology of hemorrhoid, internal hemorrhoid or piles are abnormal anal cushings, usually congested as a result of straining at a stool and traumatized by the passage of hard stool. The anal cushings are particularly prominent in pregnancy due to venous congestion caused by large gravid uterus and laxity of progesterone. With the patient in lithotomy position, the usual arrangement is that 3 major piles occur at 3, 7, and 11 o'clock. طبعاً أكو minor piles occurs in other sites. Regarding grading of hemorrhoids, الهemorrhoid بها grades. First degree hemorrhoid confined to the anal canal, bleed but do not prolapse. إذا موجودة بالanal canal, just bleeding, nor prolapse, this is first degree hemorrhoid. Second degree hemorrhoids prolapsed on defecation but reduce spontaneously. يعني during defecation تطلع but there is spontaneous reduction. Third degree hemorrhoids prolapsed out the anal verge but may require manual replacement. يعني البيشنت يرجعها بإيده. High third degree hemorrhoid, while in fourth degree hemorrhoid it is permanently prolapse. تبقى ويحاول يرجعها وما ترجع. by fourth degree of hemorrhoid. Predisposing factors. Most hemorrhoids are idiopathic, but they may be precipitated or aggravated by factors that produce congestion of superior rectal veins. These include compression by any pelvic tumor, of which the commonest is the pregnant uterus, cardiac failure, excessive use of purgatives, chronic constipation, and rectal carcinoma. Then, mostly here idiopathic, but secondary may occur due to these causes like gravid uterus, excessive use of purgative, chronic constipation, and rectal carcinoma. Occasionally, anorectal varices, similar in appearance to esophageal varices, coexist with hemorrhoids in patients with portal hypertension, since the anorectal area is the site of portosystemic anastomosis between superior and inferior rectal veins. بالضبط شلون اللور esophagus there is anastomosis بين systemic والportal circulation بالanal canal اكو communication between systemic and portal circulation. Clinical features of hemorrhoid. Rectal bleeding is almost invariable. من تذكر hemorrhoid تذكر وياها البليدنج. من تذكر الفشر تذكر وياها painful condition. This is bright red and usually occurs at defecation. In case of first degree bile, this is the only symptoms. تعرفون بالsecond degree والthird degree اكو prolapse بس بالfirst degree just bleeding. إذا هو الcardinal symptom bleeding. patient يجي يقول لك دكتور دم جاي يطلع during defecation. More excessive biles prolapse and many produce a mucus discharge, may produce a mucus discharge. And then the second or third degree فوق انه يصير بيها prolapse, mucus discharge, pruritus, ani. Prolapse is much later symptoms may result in soiling. Note that the pain is not a feature of internal hemorrhoids except when these undergo thrombosis. هي بصورة عامة إنه الهيمورويد painless condition. If it is painful, then complication is present. Anemia, rarely due to continuous profuse bleeding. بالحقيقة موجودة هواي كيسات إنه anemia يجي البيشنت anemia. فواحدة من الأمور during examination of patient with anemia is hemorrhoid for long time. Anemia may cause hemorrhoid may cause one of the causes of anemia. When a patient complains of an attack of piles, it often means that some acute painful condition has developed at the anal margin. When patient complains of an attack of bile, means that some acute painful condition has developed at the anal margin. The most common and dramatic strangulation of prolapsing piles lead to thrombosis, part from this acute pain, and may be due to the following. Acute pain may be due to the following: Fissure-in-ano, then high causes of painful anal condition. Fissure-in-ano, perianal hematoma, perianal or scorectal abscess, tumor of the anal margin, or proctalgia fugax. Proctalgia fugax, benign episodic pain relieved by digital dilatation of the anal sphincter. طبعا هاي موجودة وموجودة بالستودنت بالذات الميديكال ستودنت تصير عندهم proctalgia fugax, painful anal attacks of painful condition in the anal canal. Every patient presenting with the story suggestive of internal hemorrhoid is submitted to the following procedure. Every patient presenting with the story suggestive of internal hemorrhoid is subjected to the following: examination of the abdomen to exclude palpable lesions of the colon or aggravating factors for hemorrhoids. Example, large liver or pelvic mass, including a pregnant uterus. Then, hemorrhoid, you have to examine the abdomen because one of the causes of secondary hemorrhoid is CA rectum or CA colon or gravid uterus. Rectal examination, internal hemorrhoids are not palpable, but prolapsing piles are immediately obvious. The presence of a prolapsing pile doesn't exclude a lesion higher in the bowel. And third, proctoscopy, which will visualize the internal hemorrhoid. Proctoscopy هي instrument تقريبا 15 centimeter in length, used to examine the patient during lithotomy position or knee elbow position. We visualize the internal hemorrhoids. Sigmoidoscopy is performed routinely, again to eliminate a lesion higher in the rectum, proctitis, polyp, or carcinoma. إذن sigmoidoscopy. بالأول نبدي proctoscopy, بعدها sigmoidoscopy, performed routinely, eliminate lesion higher in the rectum, like proctitis, polyp, or CA, sigmoid and CA rectum. A barium enema is carried out in any case where symptoms such as alteration in bowel habits point to some more sinister condition than internal hemorrhoid. طبعا تعرفون إنه hemorrhoid may be the sign or symptom of CA colon. لذلك أي patient أي مريض عمره أكثر من 45 أو 50 سنة with hemorrhoid, you have to undergo sigmoidoscopy or colonoscopy. Colonoscopy may be indicated to visualize and biopsy any lesion thus revealed. Complications of hemorrhoid. فرقوا بين أكو complication of hemorrhoid وأكو complications of surgery for hemorrhoidectomy. فالcomplication of hemorrhoid, anemia following or continued bleeding. مهمة هاي إنه الأنيميا one of the complications of hemorrhoid due to bleeding. Thrombosis, this occurs when a prolapsing bile gripped by anal sphincter, strangulated piles, strangulation when prolapsed hemorrhoid grasped by external sphincter, the condition associated with severe pain. Then anemia, thrombosis, strangulation, ulceration is another complication. Gangrene when strangulation is sufficient to occlude the blood supply. And after that, fibrosis may occur. Suppuration, pylophlebitis, theoretically, infected bile may cause portal pyemia. High complications of hemorrhoid. The venous returns occluded and the thrombosis of the bile occurs. The prolapsed hemorrhoids are swollen often to the size of large plums, purplish black and tense, and are accompanied by considerable pain and distress. Suppuration, ulceration may occur after 2 or 3 weeks, and the thrombosed bile become fibrosed, often with spontaneous cure. Treatment. Before commencing treatment, it is essential to exclude either any predisposing cause or an associated and more important lesion like carcinoma of the rectum. Conservative management. Ideally, the patient should avoid straining at the stool and aim to pass a fair, soft motion daily. Bulk laxative, together with advice and adequate fluid intake, are often required. يعني مو معناها إنه أول ما يجي مريض الهيمورويد رأسا عملية، لا، عندنا إنه الكونسرفاتيف تريتمنت اللي هي patient should avoid straining at the stool, aim to pass a fair soft motion daily, يعني الموشن should be soft, and bulk laxative should be used together with advice. Adequate fluid intake is required. يعني you have to prevent constipation because hemorrhoid may cause constipation and constipation may aggravate hemorrhoid. Then conservative treatment, another method, sclerotherapy. This is suitable for first and second degree piles. 2 to 3 ml of 5% phenol in almond oil is injected above each pile as sclerosing submucous perivenous injection. The phenol sterilizes the oil, which is the main sclerosant. يعني نستخدم 5% injection of 5% phenol in almond oil. Because the injection is placed high in the anal canal above the dentate line, it is painless. تعرفون إنه painful هي lower 2 centimeter because of innervation. Okay, يعني somatic innervation. بينما الأبر 2 centimeter sympathetic innervation. One or more repeat injection may be required at monthly intervals. يعني الانجكشن may require second and third shoot or يعني another you have to give another injection after 1 month and second injection, second and third injection. يعني 1 month is interval. Bonding application, إذن هسه صار conservative sclerotherapy. Bonding application of a small O-ring rubber band to the areas of protruding mucosa which falls away after a few days. ليش نقطع البلاد سبلاي؟ باند يعني حلقة مخليها بلاستيكية around the origin of hemorrhoid. After that ischemia, after that falls away, توقع after a few days. It can be successfully applied to the first and second degree piles. The pile هي الهيمورويد, but a care must be taken to the position, the band above the dentate line. Least the patient should feel the application no more than 2 hemorrhoids in 1 session interval at least 3 weeks. يعني أكثر شيء نستخدم بس 2 hemorrhoid والinterval هو 3 weeks in order to prevent stenosis. Cryosurgery. Cryosurgery use liquid nitrogen in some center, extreme cold, 196 cause necrosis. This method has been abandoned because it caused mucus discharge and pain. يعني الcryosurgery is prohibited and stopped because one of the important complications, mucus discharge and pain. Photocoagulation, application of infrared coagulation. This method effective and painless method, but needs a special instrument for infrared application. Surgery وهنا المهم إنه most of hemorrhoid end with surgery, hemorrhoidectomy. Indications for surgery مهمة. First, 3rd degree hemorrhoid. B, 2nd degree hemorrhoid which have not cured by non-operative measures. And then 3rd degree will 4th. 2nd degree which not respond to non-operative or conservative measures. Fibrosed hemorrhoid, internal external hemorrhoid, when external hemorrhoid is well-defined technique. Pre-operative preparations for hemorrhoidectomy. شنو هي pre-operative preparation? Laxative on the evening before operation and enema also. Anal region is shaved at morning of operation. The rectum is evacuated with the aid of enema. We have 2 types of operation, open method and closed method. Milligan-Morgan hemorrhoidectomy is a closed technique where the bile are excised and the wound leave open. Post-operative care, patient take tour path each day. Give bulk laxative with appropriate analgesia. Dry dressing are necessary. Patients seen after 3 to 4 weeks for rectal examination. If there is stenosis, dilatation you have done by the finger and xylocare. Thrombosed strangulated piles. Conservative management is instituted for these thrombosed strangulated piles. The patient هاي واحدة من الكومبليكيشن المهمة وموجودة. Thrombosed strangulation. The patient is a painful condition. The patient placed in the bed with the foot of the bed is elevated. Opiate analgesia is given for the severe pain, which is also eased by local cold compresses. Often the thrombosed piles fibrosed completely with spontaneous cure. Many surgeons now carry out hemorrhoidectomy at the start of this complication in these patients. بعض السيرجن يفضل انه يشتغل hemorrhoidectomy، يسوي hemorrhoidectomy surgical procedure for this complication. Specific complications of hemorrhoidectomy. إذا أخذنا الcomplication of hemorrhoid اللي كان fibrosis, thrombosis, prolapse. هسه لا، complication of hemorrhoidectomy procedure. Early complication, acute retention of urine due to acute anal discomfort post-operatively, pain, stricture formation. This only occurs when excessive amount of mucosa and the skin are excised. It is important to leave a bridge of epithelium between each excised hemorrhoids. تعرفون مرات عندنا 3 major hemorrhoid وعندنا minor hemorrhoid in between. لذلك ما يصير كل المنطقة نشيلها وما نخلي epithelial area. ما راح يصير re-epithelialization وينتهي بالستينوسيس and stricture formation. Post-operative hemorrhage. This may be reactionary, usually on the night of the operation. تعرفون البليدنج be reactionary, primary, secondary. فالpost-operative hemorrhage after hemorrhoidectomy, this may be reactionary, usually on the night of operation, or secondary about the 7th or the 8th day. Secondary after 7 or 8 days. The bleeding may not be apparent externally. يبقى بالداخل in the anal canal and the rectum, as the source of hemorrhage may be above the anal sphincter, with the blood filling the large bowel, with the only a little escaping to the exterior. يصير عندنا massive bleeding والpatient ما يحس أو مجرد قطرات. General treatment comprises blood transfusion if hemorrhage is severe, as evidenced by the general appearance of the patient. A pulse raised above 100 and systolic blood pressure below 100. تعرفون إنه إذا صار عندنا massive bleeding أكو tachycardia and hypotension. Local treatment is carried out under general anesthesia in the operating theater. إذن نحتاج البيشنت ندخله الoperating theater under general anesthesia, and the blood is washed out of the rectum with warm saline. And we check the site of bleeding to be secured. Occasionally, a reactionary hemorrhage, a bleeding point is seen and can be diathermy or ligated. More often, there is general ooze from the operating field, and the anal canal require backing with gauze. مرات إذا general ooze نحتاج backing، نخلي له باكات شاش gauze زين which allow evacuation of flatus. هذا الجوز around a rubber tube in order to let gases and flatus to escape and any blood from the bowel. The tube and gauze are removed after 48 hours. High early complication. Late complication includes secondary hemorrhage. Stricture مهم. This only occurs when excessive amount of mucus and the skin are excised. It is important to leave a bridge of epithelium between each excised hemorrhoid. Anal fissure is another complication of hemorrhoidectomy, and incontinence. Incontinence also may be a complication after hemorrhoidectomy. Okay, now we start with perianal hematoma. This lesion, which is also termed thrombosed external bile, common هذا موجود، عبارة عن يعني thrombosed bile بالanal verge is produced by thrombosis within the inferior rectal venous plexus. Unlike internal hemorrhoid, it's covered by squamous epithelium and supplied by somatic nerve. لذلك هي بتكون painful condition. The onset is acute, often after straining at the stool, with sudden pain and appearance of a lump at the anal verge. Local examination showed tense, smooth, dark blue, cherry-sized lump at the anal margin. Untreated, this perianal hematoma either subsides over a few days, eventually leaves a fibrous tag or rupture discharging some clotted blood. يعني إذا عرفنا without treatment, perianal hematoma either subside over a few days or leave fibrous tag، يعني تنتهي fibrous tag أو rupture ممكن يصير and discharge of some clotted blood. Treatment of perianal hematoma in the acute phase, immediate relief is produced by evacuating the hematoma through small incision. يعني نخلي small incision فوق perianal hematoma and evacuation of the content, which is clotted blood. This can be done under local anesthesia, and if the patient is seen when the hematoma is already discharging or becoming absorbed, hot baths are prescribed and reassurance. That is all which is required. يعني مرات spontaneous recovery. لذلك نقول له فقط hot bath، كمادات سوي لها زين، كمادات دافية and reassurance. وطبعا مو نعطيهم إذا أكو pain analgesia with antibiotic. Okay, another subject is fissure-in-ano. A fissure is elongated. Fissure is elongated tear at the anal margin with long axis of the lower anal canal, which usually follows the passage of constipated stool. The site is usually posterior in the midline in 90% of the men, 70% of the women. إذن بالمئة 90% بالرجال، 90% هو posterior, 70% in women. Occasionally, anteriorly in the midline and rarely multiple. The posterior position of the majority of fissure is not well understood, but may be explained by the anatomical arrangement of the external anal sphincter. Its superficial fibers passes forward to the anal canal from the coccyx, leaving a relatively unsupported fee posteriorly. يعني weak area، لذلك susceptible to fissure the site posteriorly. Recently found by Doppler study that fissure due to ischemia، يعني هاي كلها theories and causes of fissure-in-ano. One, hard stool, one, ischemia. The anterior fissure in female may be associated with weakened of perianal floor following tears at the child birth. Multiple fissures may complicate Crohn's disease of the colon. Multiple fissures may complicate Crohn's disease of the colon, and some causes of anal fissure are certain. Then, high theory in how fissure in ano occur, but some causes of anal fissure are certain. شلون بالهيمورويد it may be associated with CA rectum or CA colon. هنا some causes of anal fissure are certain due to incorrect performed hemorrhoid operation. يعني one of the complications of hemorrhoidectomy, inflammatory bowel disease and sexually transmitted disease. هاي كلها ممكن تكون causes of fissure in ano. Clinical features of fissure قلنا hemorrhoid, the cardinal symptom is bleeding. بالfissure is pain. It is more common in female, especially in meridian life. It is uncommon in elderly. Why? Because of laxity. Not rare in the children. It also can occur in children. Two types of fissure, either acute or chronic. And acute fissure, in acute fissure, there's acute anal pain is characteristic. It is sharp, agonizing pain, started during defecation, lasts for 1 hour or more later. Fissure is the commonest cause of pain at the anal verge. There's often slight bleeding, and because of pain, the patient constipated. Discharge, slight discharge, and slight discharge. Chronic type characterized by inflamed indurate margin and a base consisting of either scar tissue or the lower border of the internal sphincter muscle is associated with skin tag. It is sentinel bile, called sentinel bile. On examination, the anal sphincter is in spasm. Patient with fissure in ano, examination of the anal region, anal sphincter is in spasm, and there may be a sentinel bile protruding from the anus, which represents the torn tag of anal epithelium. The fissure can usually be seen by gently pulling open the anal verge. It may be impossible to do a rectal examination without anesthetics. The fissure may be then palpable as a crack in the anal canal. You have to use lubricant or anesthetic, xylocaine gel, during examination. And differential diagnosis of anal fissure, carcinoma of the anus is early. In early stages, there is a doubt must be excisional biopsy is done. Then differential diagnosis of fissure in ano, one of it is CA anus or CA anus, and histopathological examination will differentiate. Multiple anal fissure may be associated with skin disease, AIDS, tuberculous ulcer with undermined age, and proctalgia fugax. Proctalgia fugax, which is painful anal condition. And regarding the treatment of anal fissure, early small fissures may heal spontaneously. A local anesthetic ointment together with a lubricant laxative may give relief. Application of glycerin trinitrate cream relaxes the anal sphincter, allows the torn epithelium to heal. More intractable cases usually respond to dividing the internal sphincter submucosal under general anesthesia, يسموها lateral sphincterotomy. It is important to assess the anal tone prior to perform a sphincterotomy, as incontinence may result, particularly in patients who have suffered previous obstetrical injury. لذلك lateral sphincterotomy لازم نسويها بحذر, because incontinence is a complication. It is for the same reason that an anal stretch is now seldom performed. يعني اللي هو الanal dilatation, Lord's dilatation. And your alternative is chemical sphincterotomy using injection of botulinum toxin, يعني botox, into internal sphincter. هاي واحدة من الطرق للتريتمنت of anal fissure. This has the advantage that the sphincter paralysis is short-lived, but gives a more sustained effect than glycerin trinitrate cream. Operative procedures, يعني هاي الميديكال treatment and conservative treatment of anal fissure, اكو procedure. Gentle dilatation of sphincter under general anesthesia with weak muscle sphincter. Careful with those with weak muscle sphincter. إذن أول خطوة بالoperative procedure هو gentle dilatation of sphincter. Lateral anal sphincterotomy, healing usually within 3 weeks. Operation more successful in acute than chronic fissure. And anal advancement flap more popular because incontinence is unlikely, no complication of incontinence. Okay, another subject is anorectal abscesses and the causative agent in anorectal abscesses. Causative agents 60% E. coli, 23% Staph aureus. In many cases, the infection is mixed infection, يعني E. coli, Staph, and Strep. Clinical feature in anorectal abscesses producing painful throbbing, swelling in the anal region with swinging pyrexia, يعني abscess collection, sepsis, produce painful throbbing, swelling in the anal region. Types of anorectal abscesses, perianal, 60% of the commonest abscess هي perianal, 60%, 5% submucous, ischiorectal, 30%, and 5% also pelvic-rectal. Perianal, this is commonest, result from infection of a hair follicle. It is subcutaneous portion in external sphincter and affect all age group. Submucous, high above dentate line. Ischiorectal in the ischiorectal fossa. Pelvirectal, situated between upper surface, high of, يعني high above the levator ani and pelvic peritoneum. It is pelvic abscess. This is rare, 5%. Maybe complication of appendicitis, salpingitis, and diverticulitis. And the treatment of anorectal abscesses, early surgical drainage to prevent rupture and possible formation of fistula-in-ano. Antibiotic has no major role because the area poor blood supply and concentration of antibiotic not reach the maximal concentration, so the drainage is important. Fistula-in-ano, by definition, a fistula is abnormal communication between two epithelial surfaces. Sinus is a granulating tract leading from a source of infection to a surface, cavity to the surface. مو مثل الفستولا، تعرفون ماخذينها بالمرحلة الثالثة، sinus والfistula. Fistula-in-ano is a tract lined by granulation tissue that connect deeply in the anal canal or rectum and superficial to the skin around the anus. Etiology, the term fistula-in-ano is loosely applied to both fistulae and sinuses in relation to the anal canal. The great majority result from initial anorectal abscess, which spontaneous burst or inadequate opened and evacuation. Growth of organism like skin flora and the presence of fistula result. Rarely fistulae are associated with Crohn's disease, ulcerative colitis, and carcinoma of the rectum. Then fistula-in-ano can be a presentation of Crohn's disease or ulcerative colitis or carcinoma of the rectum. يعني واحدة من البرزنتيشن. لذلك during operation من نشيل fistula should be sent for histopathological examination because in old age may be due to cancer, while in young age group may be due to inflammatory bowel disease. Anatomical classification divided into two groups. مهمة تنسألون إنه أكو standard classification of Fistula-in-ano and Park classification. The standard classification يشمل subcutaneous, submucous, low anal, high anal, and pelvirectal, while Park classification include intersphincteric, transsphincteric, high or low, and supralevator. Clinical features of Fistula-in-ano. There is usually a story of initial anorectal abscess which discharge. Following this, there is recurrent episodes of perianal infection with persistent discharge of pus. Pain is not a symptom, only if it is obstructed, unless abscess formation due to occluded external opening. Examination reveals the external opening of fistula. The internal opening may be felt per the rectum. Probing should painful and should be not used only under anesthesia. Accurate assessment require MRI examination. Magnetic resonance imaging can demonstrate the anatomy of the Fistula-in-ano. Treatment of Fistula-in-ano operation, preoperative preparation by enema, finding of internal opening by manual digital examination and retrograde probing by proctoscopy and injection of methylene blue or dilated hydrogen peroxide. Superficial and low-level anal fistula are opened and allowed to heal by granulation tissue because no sphincter, while fistula, high fistula, you have to excise the low part and upper part you have to put a satin. In high fistula, suprasphincteric and transsphincteric, only lower part of fistula is laid open, يعني either opened or excised, where non-absorbable strong ligature like nylon, a satin, يسموه satin, should be left and in the tract, and we advise the patient to give a pressure on this suture or this satin for 2 or 3 weeks, sometimes for 1 month. Laying open is error. يعني إذا high fistula, you have to prevent fistulectomy or fistulotomy completely through the sphincter because may end with incontinence, which is bad complication. Structure of the anal canal could be congenital structure, spasmodic in the anal fissure, organic, and the treatment usually depend on dilatation, depend on the underlying pathology, repeated dilatation, and plastic reconstruction, and sometimes defunctioning colostomy, or in cases of malignant disease, excision of the rectum. Malignant tumor, this is last subject, carcinoma, adenocarcinoma of the anal canal occur above dentate line and below the dentate line squamous cell carcinoma. 70% of anal tumor arise in the anal canal. 30% are squamous cell carcinoma, the anal verge. Another tumor, melanoma of the anus, bluish black soft mass may confuse with thrombotic bile and lymphoma. إذن adenocarcinoma ممكن تصير بالanal canal, squamous cell carcinoma بالanal verge and lower 2 cm, melanoma and lymphoma. بذلك نكون أنهينا surgery of anus and anal canal. Next lecture, we start with the rectum. Thank you very much.